Hey, I'm Dr. Blitzstein. Thanks for joining us. We're going to review the stretches that we went over in the office already. There are 4 of them. We're going to do hamstring stretch, glute stretch, quadriceps, and hip flexors. Okay, this is just to remind you which 4 that they were. Hamstring stretch, the easiest way is you just kick your leg up on something, right? You can just you can find a table, you can find a chair. You want to extend yourself a little bit more, you want to go a little bit higher. You should have nice balance. If you have trouble with your balance, make sure you have something to hold on to. Okay, that's hamstring stretch is very easy. Another way, you can just do a ragdoll stretch where you just kind of fall and you just let your body hang down and do something like that. You're also getting your back in there as well, but that's a good one. So there's 2 forward and 2 back. Like I said, the 2 forward one is that hamstring. The second one is the glute muscle, short for gluteal muscles. Easiest way I like to do this, just crosses over. It doesn't take as much strength, and you just pull this leg up, and you're stretching the glutes here, and you're pull it toward your head and toward the opposite shoulder a little bit, and just gently pull. You don't have to use a lot of strength. Okay, there's that one, and then we're going to do the other. That we got 2 that are going back. We have quadriceps. You can use either the opposite hand, or you can use the same hand, and you definitely get it. Well, I like to hold on. So you're going to just do this, and then to intensify. This doesn't really get the stretch for me. To intensify the stretch, you're going to pull that knee down, or basically move that knee backwards, and then you should really feel that stretch. If it's hard on the knee, there's another way to do it. I'm going to show you. But so sometimes it's easier with that same hand. Sometimes you're going to want to use, well, the opposite hand. Let's try it back with the right way. And of course have something to hold on to with that. So you have 2 forward, 2 back. The second back one is hip flexor stretch. So I like to use the table. When I'm here, you can use a bed. And I get 1 foot really far forward and this knee really far back. And then you're just going to let this thigh get pushed backwards. And you're going to feel that stretch in that hip flexor. You're going to just push it back and let your pelvis sink into the table. You don't need to be doing this. It's all in here. This is where you want to open up. Not the low back, in the hip, the leg into the pelvis there. And you just breathe and relax into that. Another way to do that, a really good way, is again, you're still pushing that thigh backwards. You can find a chair, a table, you can put a pillow or something, or folded blanket under your knee that's hard on the knee, and you're going to push that thigh backwards. And you're just going to come forward and let this thigh get pushed backwards like that. And that's a really nice way to do it as well. So those are the 4 stretches, and you can start just by doing 10 seconds. Rest, switch the other leg. You do 10 seconds with some rest in between on each side, and then eventually you can increase to 30 seconds and doing it a little more intensely, going a little bit further. If you have any other questions, come back into the office or contact me here and we can answer any of those questions for you. Thank you.